Today, we're diving into the critical role of informed clinical opinion when determining eligibility for early intervention services, especially related to social emotional development in infants and toddlers ages birth to 3. This tool, informed clinical opinion, allows us to see the full picture of a child's development beyond what formal assessments alone can show. So, what is informed clinical opinion? It refers to a qualified practitioner's reasoned decision making based on professional knowledge, direct observation, caregiver input, and a child's developmental history. It's an essential part of eligibility determination under Part C of IDEA. It isn't a fallback, it's a formal, evidence informed method to recognize when a child is at risk, even when the scores on formal tools may not reflect it. Social emotional concerns in children ages birth to 3 can be subtle or masked by co occurring delays. Behaviors such as lack of eye contact, excessive tantrums, resistance to touch, or difficulty forming attachments can signal underlying developmental needs that standardized tools might overlook. Informed clinical opinion empowers the early intervention team to say, this pattern isn't typical, and this child needs support, even when the delay isn't measurable in percentages. So let's look at an example. Maya is 22 months old. She doesn't make eye contact, often avoids play, and rarely responds to her name. On her developmental assessment, she just misses the cutoff for a 25% delay. However, the team observes significant difficulties in her ability to engage emotionally with her caregiver, and the family shares that Maya becomes distressed during transition and rarely seeks comfort when upset. Using informed clinical opinion, the team determines that Maya demonstrates atypical social emotional development and qualifies for early intervention services based on informed clinical opinion. So, how can we use informed clinical opinion ethically and effectively? Well, it should be well documented, team based, and grounded in evidence, not just intuition. It should include observations across multiple routines, developmental history and caregiver input, and a description of concerns and justification for eligibility. In Virginia, informed clinical opinion is fully valid for determining eligibility and is particularly important in areas like social emotional development where formal tools fall short. Keep in mind, though, informed clinical opinion cannot be used to negate eligibility established using appropriate assessment instruments or procedures. So, in closing, informed clinical opinion isn't about making a guess. It's about applying our expertise to recognize when a child needs help. When used thoughtfully, informed clinical opinion becomes a bridge to early intervention services for children who may otherwise be overlooked. So, thank you for being thoughtful advocates and critical thinkers in your work with families. Let's continue to use every tool available to ensure children receive the support they need when they need it most.